Let's bust some myths that functional medicine is not evidence-based. So I hear it all the time. People are like, "Oh, it's not evidence-based. It's not evidence-based." Okay, let's debunk this. My name is Dr. Erica Steele. I'm a holistic doctor in family practice and board certified naturopath. I hold 6 degrees in my field, and they're all in the natural healthcare space. And so I do lots of research and study, and I've been in school literally forever. So let's talk about what evidence-based means. Evidence means that we have some sort of larger entity that signifies that what we're doing is considered healthy or efficacious, right? So what we're pretty much saying is that there's a study that validates the fact that that berberine, is successful, or that chromium is successful in managing diabetes, et cetera, right? So what they do is they take a sample size of human beings. A lot of times they do not include people of color, which is a real issue. And so because our bodies synthesize and process very differently than others, and so they take this sample size and then they create a controlled experiment and then are able to assess. There's a lot of different issues with larger studies. So here's where functional medicine really does well. Instead of relying on those particular studies, what we do is we take that data on you as an individual. So we're not looking at 1,000 other people who are not like you. We're looking at you as the individual. And so we look at your signs, your symptoms. That's all what we call qualitative data or subjective data. And then we take basic laboratory and also advanced laboratory. So we take labs and we know how to read them, run them. We know which ones to run and read, et cetera, far better than our allopathic counterparts because we're trained more extensively in clinical biochemistry, which is really how the body works. And so when we do that, that's our quantitative data. So that's data that we can measure. So we look at the qualitative, and which is your signs and symptoms that creates nuance for the case. And then we look at that measurable data. So we take baselines and then we put a patient on a treatment, or at least I do put a patient on a treatment, and then we measure the outcome. So I typically run labs every 6 months. And that's why medical doctors tend to refer patients to me, because I'm not telling them crazy stuff like come off of all your medication and you can only do natural. No, we really work integratively together if a medication is on board. If it's not, then and it's safe for the patient, then we can treat completely natural. So what we do is very evidence based. I'm not basing things off of signs or symptoms or theory alone. I'm simply basing it off of the data, things that are outside of me that I can prove and disprove. And through all of that, we're able to get results. So if you are interested in getting results, please check out some of my lives, like, share, subscribe, and also save this particular video. And if you really want to take it a step further and have me review your labs, I give you a 30+ page report and go over it in detail. I may actually do a live like that. Go ahead and click the link in my bio to learn more. If you have specific questions for me, please check out one of my lives. I hold them all throughout the week, Monday through Friday.